I'm Koski. KPMG has been proud to serve both government and healthcare clients for well over a century, and as a result, took seriously early on the COVID-19 pandemic. We increased the frequency of our one-on-one client interactions. We formed an internal task force. We brought in external advisors around things such as disease management, epidemiology, and public policy. And we disseminated thought leadership related to restarting America and the new normal. Now, even as vaccines become available, we know that one significant challenge lies ahead: efficient distribution of the vaccine to the populations that need it most. I'm pleased to share with you that we have developed a set of solutions to help address this challenge.
At times, we must all feel that we're awash in a sea of data. And with even greater access to information, government is no different. And yet citizens rely on these institutions to meet the most important of these needs and as effectively as possible. With Morehouse School of Medicine, KPMG developed a way to aggregate such everyday data, such as sociodemographics and geospatial positioning, and making it available in the context of a user, whether that's government, practitioners, or the general public. The end result is pinpointing those areas of opportunities and helping prioritize delivery based on expected outcomes. In this example, we're going to show you how a citizen would use this platform to really understand the incidence of COVID within their geographical area by zip code.
So let's get straight into it. And so what you see right now is the home page for the platform that we built. And this home page basically provides information and targeted resources for underserved communities that we're targeting. And so they can get access to latest COVID-19 information. They can subscribe to be a part of this platform. And this subscription is available for both citizens and community-based organizations who want to be a part of this platform. They can register for events that are available, like webinars and seminars. They can also get access to location-based resources. And so you can have access to a symptom checker, view risk in their areas, social and health services. And so a user can easily type in their zip code and start to get access to everything that's available in their locality. And this integration or this functionality is made possible by a direct integration to KPMG's Signals repository, which collects data from different sources to provide these resources to the users. As you can see, I can quickly see the testing centers around me. I can click into each testing center to see what they provide and what they accept in terms of Medicaid and Medicare. You can get directions to each testing location that I want to get to, or be it a CBO or a pharmacy. I can see how long it takes. I can also get some transit options, right? So public transportation, ride share services. I can get all those integrated within this platform. So this map shows you just at a very detailed level what the risk around me as far as COVID-19 are. I can tell you the zip codes that are most affected by COVID-19. I see the rates and the trend month over month, and see how this is increasing or decreasing. So this gives me an in-time insight into what the COVID-19 rates are around where I live.
So the Signals repository is a platform, a back end to this superstructure that we have engineered and have been operating for almost 5 years. The Signals repository connects to 65,000 open source signals. It connects to them at their source. Those sources are represented by 500 different publishers, 500 different URLs, constituting 1,200 tables, ultimately 65,000 signals. Now, this platform is actually a machine learning and decision science platform, and we've configured it for very specific purposes here, and it really caters to two different audiences. It caters to the individual. Hey, I'm a person. I need help. Where might I find it? And the other is to the organization or the institution or the advocate. hey, I'm an organization. Where do I see a concentration of people who need services? And do I see a paucity or an abundance of those services for those concentrated people? And do I need to go out and recruit public or private money or assistance in order to serve that population or those people?
And so moving over to the vaccine management portal, as you can see, users can access this portal to do a bunch of things. Now, this portal caters to two categories of users: the citizens who are trying to get vaccination, and partners like pharmacies or health organizations who want to collaborate with state agencies to be a part of disseminating vaccinations to the community. And so the first thing that this provides the citizen, of course, is to get access to up-to-date information about COVID, testing, pre-existing conditions, vaccination. So it's a knowledge pool for them to learn what's going on and see what the latest is as far as vaccination research. The other thing that they can do is to register, right? So they can register to be vaccinated. And we have this form built in a way where they can enter information for us to determine eligibility and also to prioritize who comes first when we start to plan vaccination. Upon registration and when vaccination becomes available, citizens can also come in here to schedule a vaccination appointment based on where they live, their locality, and also based on the plan that we've put in place as far as prioritization, right? And so we have the information already. Information gets pulled forward, and they can go ahead and schedule an appointment and choose their preferred provider based on availability, and choose the right time slot, right? And so all that's available to them from a citizen's perspective. Now, going over to the provider perspective, so let's say that I'm a pharmacy or a health organization who's interested in being a partner with the state agency in helping to facilitate vaccination in specific areas nationwide. I can go ahead as a provider and register my account to be part of this platform. Now, this is really just the front end. This is the portal. Now, the power of the vaccination management as far as logistics and the dissemination or the administration all comes in when we start to look at these dashboards. So as a state agency, I can quickly look at these dashboards and start to get reports on a number of vaccination signups, how many people have signed up to be vaccinated. I can start to plan and prioritize based on the information that I have. I can see real quickly which partners have a vaccination in store, and I can see the inventory. I can manage inventory and respond to any request. I can also see a quick map on how the vaccinations are being administered, if there are any adverse effect or any pre-existing conditions. This gives me a good view of the data that's available to me, and I can make informed decisions based on the information that I have.
This is just a brief window into the possibilities of using a technology-enabled, data-driven, user-friendly approach to vaccine distribution. KPMG believes strongly that government, as well as the healthcare provider and retail sector, need to come together as an ecosystem in order to effectively address this challenge. We look forward to talking with you further about the role that your organization can play and how KPMG can help. Thank you.